Bleeding in early pregnancy is a condition that causes a lot of panic for the pregnant woman as well as her family. Bleeding in early pregnancy, that is bleeding within the first 12 weeks of pregnancy, especially within the first 8 weeks, happens in approximately 15 to 25% of all pregnancies. So it's not uncommon, but equally, it is not considered normal. Any bleeding in pregnancy needs a consultation from an obstetrician immediately. So what are the causes for bleeding in early pregnancy? Number one is the implantation bleeding. When the fertilized egg implants itself into the wall of the uterus, there may be some bleeding, which is called implantation bleed. It can happen around about the time of the missed period, and it is very, very normal, and nothing has to be done with regards to the implantation bleeding. The second common cause for bleeding in early pregnancy is a miscarriage. A miscarriage is a pregnancy loss that happens before 20 weeks. And there are different types of miscarriage, like threatened miscarriage, inevitable miscarriage, missed miscarriage, incomplete, incomplete miscarriages. And the treatment depends on the type of miscarriage and the presenting symptoms. And miscarriage in itself is a huge topic, which we will talk separately. The third common cause of early pregnancy bleeding is an ectopic pregnancy. Ectopic pregnancy is a pregnancy outside the womb or the uterus, usually in the fallopian tube. It occurs in approximately 1 to 2 every 100 pregnancies. And it is a life-threatening condition. If an ectopic pregnancy is diagnosed, immediate action should be taken after consulting your healthcare provider. The other cause for bleeding in early pregnancy is a molar pregnancy, in which the baby doesn't form, but the pregnancy tissue converts itself into a tumor. It is also a serious condition which needs immediate treatment by an appropriate specialist. Early pregnancy bleeding is not always from the main body of the uterus. Sometimes changes in the neck of the uterus or cervix may also contribute to early pregnancy bleeding. For example, hormonal changes in pregnancy may cause some changes, which we call the ectropia in medical terms, which can cause early pregnancy bleeding. Usually, it settles with time. There may be other causes like cervical polyp, which can cause early pregnancy bleeding. Sometimes, some infections in the genital tract can also cause early pregnancy bleeding. So what do you do when you have bleeding in early pregnancy? Please consult your doctor immediately. The doctor would take a detailed history, do a clinical examination, run some blood tests, and order for an ultrasound scan. So an ultrasound scan would most often lead to a diagnosis, and the management would depend on what we find in the ultrasound scan. Most early pregnancy bleeding do have a good outcome, so do not panic about it. Also, I would insist that after consulting your doctor, please attend your follow-up appointments regularly. Usually, the bleeding will settle with time, but then again, it depends on the cause for the bleeding. So, any early pregnancy bleeding, please don't panic. Consult your obstetrician and follow her advice. Thank you.